Thank you for joining us today for a very important webinar on the physical and emotional side of severe allergic reactions. My name is Kyle Dine, and I'm a program coordinator at Food Allergy Canada, an allergy educator, and an individual with multiple food allergies. Today, we are incredibly lucky to learn about allergic reactions from a medical standpoint with Dr. Julia Upton, but also from the firsthand experiences of a very brave and insightful panel of youth with food allergies. But before we get started, I want to note a few items. Please note that this presentation is for informational purposes only and will not provide specific medical advice, recommendations, diagnosis, or treatment. Please talk to your doctor about any concerns or questions you may have regarding your own health or your child's health. All participants are muted so we can keep the audio clear for the webinar. If you have any questions during the presentation, please submit them in the chat or question box throughout the webinar, and we'll try to get to as many questions as we can. Lastly, this webinar will be recorded and shared on foodallergycanada.ca afterwards in case you want to refer back to it or share it with others. Before I introduce Dr. Upton, let's do a few quick polls just to get an understanding of who we have in session today. Our first poll question: have you or your child ever experienced an anaphylactic reaction before? Yes, no, or not sure. All right, let's see what the results are. So the majority, 56% have experienced an anaphylactic reaction before, 36% no, and 8% not sure. All right, thank you. And we'll do one other poll question before we get started. And this poll question is, how confident are you in recognizing, treating, and managing an anaphylactic reaction? Are you very confident, somewhat confident, or not confident? All right, let's see what the results are. So 67% are right in the middle with somewhat confident, and we really hope that this webinar will help you increase that confidence in recognizing an anaphylactic reaction, managing it, and treating it accordingly. All right, thank you. And now I would like to introduce Dr. Julia Upton. She is a Canadian allergist who is on staff at the Hospital for Sick Children in the Immunology and Allergy Department and an assistant professor in the Department of Pediatrics at the University of Toronto. Dr. Upton is the chair of the Anaphylaxis and Food Allergy section of the Canadian Society of Allergy and Clinical Immunology and a member of the Healthcare Advisory Board for Food Allergy Canada. Welcome, Dr. Upton.
Thank you very much, Kyle. So yes, this is just a bit of background information about anaphylaxis. And thank you for that kind introduction. So we're going to talk a little bit about the background of allergies and anaphylaxis, what happens to the body with a reaction, the signs and symptoms. And we'll talk a little bit about cofactors because there are other things that we can try to control to minimize the severity of an allergic reaction if it happens, and we'll talk about the treatment. So just to mention, there are many things that can happen with foods, and I know this audience is very familiar with different types of food reactions, but when we're speaking of allergy, we're speaking about an immune-mediated food reaction. There's lots of other things that can happen with foods. So sometimes very fatty foods can give people a stomach ache, or some people are lactose intolerant where they can't digest a certain component or sugar that's in milk. These aren't the types of reactions that we're speaking about when we talk about allergies. We're talking about the immune-mediated ones. And then within those immune-mediated ones, there's different types of immune-mediated food reactions. So for example, things like celiac disease, that is immune-mediated, but it isn't the type of reaction that we're talking about when we're speaking about foods that can cause hives or swelling or anaphylaxis. So the type that we're talking about is caused by IgE antibodies, and that's why we often call these IgE-mediated food reactions, and they are the ones that give the risk of severe allergic reactions or anaphylaxis. So just as a brief background, just talking about what happens to the body in an allergic reaction. So at the very top is a B cell. It's a type of white blood cell. And the very first time an allergy-prone person encounters an allergen, such as whatever food you might be allergic to, maybe that's peanuts or milk or tree nuts or something else, then what happens is the person makes large amounts of that food-specific IgE antibody. So the B cell kind of grows up and turns into this plasma cell and starts making these antibodies against that food. Then these IgE antibodies attach themselves to a different type of cell called a mast cell. And then what happens is that the next time the person encounters that allergic food, their allergic food, then it binds to that IgE antibody, and those mast cells release the chemicals that we know cause the allergic reaction. So for example, histamine, but also lots of other chemicals. And it's these chemicals that cause the characteristic symptoms of allergy. And this is just modified from a Wikipedia picture that was actually for ragweed, but just to kind of give a background of what's happening and why this is an immune system issue. So then the signs and symptoms that happen when these mediators or these chemicals are released are that the skin can have hives or swelling or itching or warmth or redness. You can have breathing problems with coughing or wheezing or shortness of breath, chest pain, throat tightness. You can have a hoarse voice. Often there's significant upper respiratory symptoms like nasal congestion, or it can, at the beginning, it might be confusing. Is this hay fever-like symptoms with runny or itchy nose or watery eyes? Some people have trouble swallowing. You can also have stomach problems, so meaning feeling cramping or pain or having vomiting or diarrhea. The cardiovascular symptoms can be feeling faint or looking pale or actually passing out. And then there can be others like this anxiety or this, some people call it an impending sense of doom, where people have almost like a premonition that they can feel that something bad is about to happen. And neurological symptoms like headache, women can have uterine cramps. And some people say that they get a funny taste in their mouth. I've just noted here that hives are very common in anaphylaxis, but they're not always present. And when they're not there, it can be a lot harder to recognize this as an allergic reaction. So it's just good to know. One of the questions I get is, will my allergic reaction always be the same? And actually, allergic reactions can vary quite a bit, even within the same person. And there's just many, many factors that go into how severe is that allergic reaction going to be today. So I've just symbolized this with a ridiculously complicated equation. Don't worry, I don't know how to solve it either. But there's really many parts to the equation of how severe an allergic reaction will be. And two of the key pieces are the amount of food that's ingested, but also the other things that are happening with your body at that time. So just to show this in a picture, so allergic reactions happen after the body is exposed to a certain amount of food. So in this picture, I'm showing that this is the amount of food that somebody has eaten, and this is what we call the threshold. So the threshold is the amount of food that's needed to cause a reaction. So there's an amount of food that's needed to cause a reaction. And in this picture, we're showing that maybe somebody had a really small exposure and this blue line, so they ate that accidentally perhaps, and nothing happened because there wasn't enough to actually trigger this allergic reaction. And on another day the same thing happened, and on another day the same thing happened. But then on this day they ate enough to trigger this reaction. So this threshold is different between different people, and anyone in the group that's done an oral food challenge, for example, and that's where in a medically supervised setting you eat little bits of the food to see whether or not you're allergic, then you can see that not everybody reacts on the very first step of that. Some people react, after hitting a certain amount of food. So this threshold can be different within different people. But one of the complications of this is that threshold can actually change. And so in this picture, it's basically the same as I had before. But what I want to show here is that certain things can make that threshold go down. And so in this picture, when we talked about on the last slide that somebody maybe had a small exposure, they were fine, and a small exposure, they were fine, and a small exposure, they were fine. In this picture, what's happened is that threshold, or the amount of food that it takes to cause an allergic reaction, has been lowered. And why has it been lowered? So some of the things that are really known to lower this threshold are exercise, for example, or put a calendar there because the time of year can make a difference. If you're in the middle of a pollen season, for example, you might have a worse reaction. And then also I have a picture of someone who looks ill. So illness can also lower this threshold. Other things, alcohol can also lower the threshold. Alcohol can also make people, less vigilant about avoiding food. So for two reasons, alcohol can be a risk factor for allergic reaction. And then also certain medications, for example, NSAIDs or like Advil, ibuprofen, that kind of medication can also reduce this threshold, as well as some other medications. And asthma. So asthma is, you can imagine if the lungs are already suffering from asthma and it's not very well controlled, then having the allergic food on top of that can make the lungs extra twitchy and can create this allergic reaction at perhaps a lower amount than would have happened if the asthma was better controlled. And also the reaction could be more severe if the asthma is not controlled. So just summarizing at the bottom there, I just have that, cofactors. These are the factors that reduce the amount of food that it can take to trigger an allergic reaction. So that might be new to some people. I think that it's, it is helpful to, it's not a perfect explanation, but I do get a lot of questions about how come it's not exactly the same, or do I expect it to be the same, or will my next reaction be worse? These kinds of questions, and maybe now that really complicated equation might help you to know that it's actually quite difficult to predict. But there are things that we can try to control to reduce the severity and to reduce the chances of an allergic reaction. So why does this threshold change? And so we don't know exactly why. Probably some of those factors, those cofactors that I showed, probably some of them increase the food absorption from the stomach. Maybe they change the allergic chemicals, either how much is released or how they act on the receptors in the body. We don't know exactly why, but we do know that there are definitely things that can change the threshold. So in terms of the management, the avoidance of allergic reactions, so I just have this picture of plan because, as you know, it takes careful planning, including reading labels and being cautious and sometimes bringing your own food. And there's lots of things that people do every day to keep themselves safe. And then in addition to that, making sure that asthma is controlled and being extra cautious if there's any cofactors involved is just another piece of information you can have to try to keep yourself safe. So the treatment of anaphylaxis is epinephrine. So it's the intramuscular epinephrine that this is a vial here, but you very likely have that in an auto-injector. And then we also recommend that people either lie down or if they were seated, then to stay seated, just because when someone's having anaphylaxis or a severe allergic reaction, if they have a very sudden movement, then they can pass out. It's a bit of a strain on the heart to move very quickly when the body is in the middle of this allergic reaction. So that's why we recommend that people are lying down or seated if that's more comfortable for them, but no sudden changes in direction. What about antihistamines in the management of anaphylaxis? Antihistamines can certainly make you feel more comfortable. They help with itch, but they're really not quick enough to help the severe symptoms of anaphylaxis. They probably just don't. We know from how quickly they're absorbed from the stomach and from the bloodstream that really they just don't have the time of onset required to help the respiratory symptoms or the cardiovascular symptoms. And it's really not clear that they help enough anyway. So that's why epinephrine is the mainstay of treatment, and the antihistamines are really just an extra medication to help people feel more comfortable. They really should not be used instead of epinephrine. So in summary, food allergy is an immune system reaction to the food, and the signs and symptoms can include the skin, breathing, stomach, and heart symptoms, as well as sometimes neurological symptoms. And many factors are at play of how severe an allergic reaction can be, and so we just try to control what you can. And the treatment for anaphylaxis is with an epinephrine auto-injector. And if you're not sure about a reaction, is it enough? Then the safe choice is to use the epinephrine.
Yes, thank you very much, Dr. Upton. And we're very lucky today to talk even further about allergic reactions from a firsthand experience with our youth panel. And each one of them are going to go into their own story about an allergic reaction they experienced and share some of the emotions and really what happened, not only on the physical side, but on the emotional side. So we really appreciate all of them speaking to us today. And to start off, we'll have Julia tell her story. She's 26 years old, loves swimming with allergies to peanut, tree nuts, fish, crustaceans, and mollusks. Welcome, Julia. Feel free to take it away and tell your story.
Hello, good afternoon, everybody. I hope everyone's doing very well. I'm going to share one of my most recent allergic reactions with you all, and this happened to take place, just to preface it, right after Halloween. So normal day for me, and I was going to go to the gym, which is very usual for me, and it was in the afternoon. Upon looking back, I don't think I looked at it or I thought about it in the moment, but I did at one point in the afternoon grab a chocolate from Halloween from like the bowl that we had in my kitchen. Now, I didn't look inside the bowl. I didn't look at the chocolate I was grabbing. I didn't look at the ingredients. I just absentmindedly grabbed the chocolate, opened up the chocolate, and threw it into my mouth, and then forgot about it.
Julia, I'm just going to jump in for a second and ask, could you turn on your webcam? Just so we can see the story come to life a little bit more. Thank you.
Yes, sorry, I totally forgot.
All right.
So yes, as I was saying, I threw the chocolate in my mouth, absentmindedly forgot about it, and proceeded to go to the gym after. So I was walking on the treadmill for about 10 to 15 minutes before I started feeling a little bit strange and unusual. So I started feeling like I couldn't catch my breath necessarily. I felt like I was sweating a lot more at a lot of a quicker time than I usually do. And I just felt like I couldn't take a full breath in, like my chest was kind of constricting. Now, I also do have asthma, so I kind of thought, oh, perhaps like this isn't just a very good date for me at the gym. I'm gonna go home, I'm gonna relax. So at that point, upon leaving the gym, I had no idea that it was gonna go any further than that. So from the time that I walked out of the gym to the time that I walked out to my car, I had gone into full-blown anaphylaxis. So I had realized something was going on because I was increasingly having difficulty breathing or taking a full breath in. My swallowing started to get a little bit strange. And this is a common symptom for myself, I feel like my voice changes as a result of the constricting of everything that's going on inside of me. So with all of those symptoms, I realized that I was going into anaphylaxis. So at that moment, I grabbed my auto-injector and I injected myself with the EpiPen right in the parking lot. So I grabbed my phone to call an ambulance, to call 911, and coincidentally, at that time, my phone decided to die. So I was all by myself. I had just injected myself with my auto-injector and my phone was out of battery. So the next thing that I did was I walked into the fast food place next door, and when I entered, I screamed out loud, "Hi, I need help. I'm having allergic reactions. Someone needs to call an ambulance for me right now." So at that moment, the workers at this fast food place, who were probably all a lot younger than me, jumped into action and they really assisted me when I really needed it. I had one worker cleared out the entire restaurant. Another worker came and sat next to me and just like held my hand while another worker was calling 911. Luckily, the ambulance came very quickly and they were able to get me to the hospital and get me everything that I really needed in that time. I think the biggest thing that came up for me emotionally in that circumstance was the fact that I was all alone and the fact that my phone died. In that moment, I wasn't able to contact my mom or my dad or my sisters and tell them what was going on with me. So I was at the hospital all by myself, and I was at the hospital alone. So I felt a little anxious as a result of that because nobody knew where I was. And as far as they knew, I was still at the gym. At the same time, looking back at that allergic reaction, I realized upon everything happening, the mistake I had made earlier in the day with the chocolate. So in that moment, I learned that it's very important to ensure that you're keeping track and being mindful of what you're eating throughout the day.
Thanks so much, Julie. And what an incredible story, especially just your quick thinking when your cell phone battery dies of what you do in that type of situation. So thank you so much for sharing that with us.
Thank you.
So our next panelist is Harrison. He's 23 years old. As you've seen in the picture, likes Tai Chi. His allergies are milk, egg, tree nuts, fish, crustaceans, mollusks, soy, sesame, apples, pears, and cherries. Welcome, Harrison.
Yeah, hi everyone, I'm Harrison. My reaction story is a story of carelessness, basically. So when I was about 20 or so, my friends invited me to an all-day kayaking trip. I'd never been kayaking before. So this was about 30 people in total. My first mistake was I did not bring my auto-injector with me into the kayak. I thought if I got wet, it wouldn't work. So I just, for some reason, didn't think to ask, like, if I could, if I didn't know about water bags, like, I just didn't think about it for some reason. And I thought I wouldn't eat anything. I underestimated the amount of energy it would take to kayak. So I decided not to bring it with me, which is really silly. During the afternoon, it was really great. I had a lot of fun. And then we parked for lunch at a few picnic tables. And there was someone who had, my friend's mom knew about my food allergies. So she said, I made you a salad that had nothing, it was free of your allergens. And I, being really hungry and underestimating, because I'd never been kayaking before, I said, okay, I'll try some of it, which is another mistake. Later on, I'd find out that the balsamic vinegar had an egg component in it that I didn't know about until it was too late. So I had about a half of the salad, and then I started to feel my lips were itchy and tingling and red. And so I decided to take a small walk and just come back to see if maybe it was just some other factor. I walked alone, which I should not have done. I should have asked my friend to come with me just in case that there was I did have a reaction, because it turns out I did. I walked a small way, and then I started to get a really tight chest, and my heart started to beat really fast and loud. And I could tell. I didn't even have to put my hand to my heart. It was just so loud and intense that I could tell. And also mentally, I experienced this feeling of not wanting to be a burden on people. I felt really scared. In hindsight, I think it was because I didn't know that friend super well. Like, we were good friends, but not closest of friends. And he knew about my food allergies, but had never seen it before. I haven't shown him a video or anything, that kind of thing. So I felt a little bit weird asking him, but my shortness of breath got so tight that I had no choice. I asked him. I had to text him what the problem was, because I couldn't talk properly. So we called the campus staff, and I started to close my eyes, and I just told myself, just one more breath, just one more breath. And I think I was without the auto-injector for about 5-10 minutes while I was in the vehicle on the way back to my friend's car, where I injected myself in the parking lot. And then the ambulance came a little bit later. And I passed out sometime around then, and I woke up a little bit later in the hospital with the nurse and my parents, and then I went home a little bit later. I was spooked for about a week, I would say, after that incident, just thinking about that memory and how I've never been in that kind of state before. That's the most severe allergic reaction I've ever had in my life. And so I think what helped me to come out of it was I went over the story with my parents, and I went over the story with my friend. I've talked about it and done kind of mental simulations at least 5-10 times. And so I find that every time I went over it, I felt better and better. And as I said, it's a story of carelessness. So I really felt like, you know what, I could prevent this next time if only I had done the right prep work. I had done the checks and balances. I should have brought my own thermos. I don't know why I thought I could have survived without it. Well, I could have just had nothing to eat and I would have been fine. It's kind of silly of me. So just knowing that if you do the proper prep work and you think it through really carefully, then I felt a lot more confident in doing this in the future. And so if my friend invited me again, I would totally say yes, because I had a lot of fun. So thank you. That's my story.
Thanks so much, Harrison. What a story that is. And it really shows how important it is to be prepared for all situations, especially ones where you're not even really expecting that you'll be eating later on. But as you said, kayaking can be a lot of exercise, work up an appetite. So thank you so much for sharing. Our next panelist is Michael, who's 18 years old. Hobby is watching basketball. His allergies are peanuts, tree nuts, fish, crustaceans, mollusks, egg, peas, and sesame. Michael, welcome today. Thanks for joining us.
Thanks, Kyle. Happy to be participating today. So I'm Michael, and I'm going to share with you one of my recent allergic reaction stories. So after a workout, my buddy and I made a smoothie with protein powder that unknowingly contained pea protein, where I had misread the label. Nutritional supplements have medicinal and non-medicinal lists for the ingredients, and they're not always on the same spot in the package, which can make it kind of confusing. In this case, I read the medicinal ingredients and it looked fine, but after I had the reaction, I went back and looked at it again and realized that I had not read the non-medicinal ingredients. My symptoms started with just an itchy throat, but eventually escalated to swollen lips and face. Having an itchy throat is always a common symptom for me that has appeared in most of my reactions, but the swollen face and lips wasn't. Symptoms of anaphylaxis can sometimes be confusing, but when my reaction went beyond the typical itchy throat and then moved to swelling in my lips and face and some throat tightness, I recognized this is two body systems reacting. And that's when I knew it was anaphylaxis. And honestly, for me, if I think that I need to use the EpiPen, it doesn't really matter if it's anaphylaxis or not, I'm going to use it. During my reaction, I initially freaked out, but I reminded myself that the auto-injector works. If I take the proper initiative, I'll be fine. I got the support from my buddy who got a school employee to help organize an ambulance. People think that reactions are embarrassing and might try and handle them on their own, but in my experience, people just want to help. Like they don't want anything bad happening to you, so make sure you let someone know and ask for help if you're having a reaction. I didn't delay using my auto-injector once experiencing symptoms. I injected myself within the first 10 minutes of my reaction. I know some people fear using the auto-injector, but honestly, for me, it's painless. You don't see the needle. For me, I'd be more worried about getting a flu shot. People need to understand that there should be no fear behind the use of an auto-injector. It really works. For those who haven't used an EpiPen, after you're injected, you will experience an increased heart rate. You may feel jittery, but it really works and helps decrease the symptoms right away. Going forward, I learned that I need to be more diligent on reading the label. I think it's important to emphasize the difference in labeling on nutritional supplements, as it's split up sometimes into medicinal and non-medicinal ingredients. Furthermore, a big note about pea protein is it's becoming more prevalent and in a lot more foods, especially vegan and nutritional supplements and foods you wouldn't expect. So if you have an allergy to peas, take some extra time to read the label and ask questions, as it's not recognized as a major allergen. So it's definitely something that I'd highly suggest looking out for. Managing another reaction just gives me the confidence in handling future reactions. It's not something to brag about by having multiple reactions, but as I experience them again and again, I gain that confidence knowing that the protocol works and I'm ready to manage it in the future. Emotionally, having a reaction hasn't really phased me because, as I said, like I know how to assess them and treat them and I have the proper protocol. So it doesn't really emotionally phase me anymore. And yeah, thank you for listening.
All right, thanks so much, Michael. And what a story highlighting an incredible confidence that you have in treating your own reaction. And I'm sure if it's a great opportunity right now, if people are starting to think of questions, start typing them in, because you know, someone like Michael has the secret formula inside of how to be confident in such a tricky situation. So thanks, Michael. I'm sure there's going to be some follow-up questions for you. Awesome. And yeah, we have one more panelist. And I'd like to now introduce Viktoria, who is age 15. Her hobby is, as you can see, reading, and she has allergies to peanut and tree nuts. And I know her reaction story is very recent, so we really appreciate Viktoria speaking with us today. Welcome, Viktoria. How are you?
Hi, my name is Viktoria. So when I was first asked to talk about my reaction, I was going to speak about my experience as a 2-year-old. However, upon my arrival at a cottage country resort, I experienced a reaction. So since I have had no reaction for the past 13 years, it just goes to show you that you should always expect the unexpected no matter where you are. So I first had dinner and dessert, and I was diligent in making sure the food was completely nut-free. In retrospect, after discussing with the food and beverage manager, I believe it was cross-contamination that caused it since there was no evidence of what I reacted to. So after dessert, I noticed some symptoms of my first reaction. So lip swelling, tingling in my mouth, and I had difficulty swallowing. I was feeling really scared of the unknown because I had never really experienced a reaction that I can recall to this day since I was so young the last time I had it. Also, I was on vacation and not familiar with my surroundings. I was in denial for a bit. I questioned if this was a serious reaction or if it was a side effect from the long day of travel. And I'm pretty sure I'm a pretty sensitive person, so I often get skin rashes, stomach aches, and all that more easily than others. But then I remembered the information I learned from Dr. Moshe Ben-Shoshan in another food allergy webinar just like this one, saying that it is crucial to administer my epinephrine within the first 30 minutes of an anaphylactic symptoms. So my mom administered the auto-injector because I was afraid of not being confident in the administration. I wanted someone that was assertive and would administer it correctly. I was afraid that I would put the auto-injector in and then recoil and remove it before I got the proper treatment and waste my one EpiPen that I had. So it turned out that the pain from the auto-injector didn't compare at all to what I thought it would be. It was not painful at all. After my auto-injector, we went directly to the resort concierge to find out where the nearest hospital is. Fortunately, it was only 5 minutes away, and it would have been faster for me to be driven there rather than an ambulance, so I was driven there. When I got to the hospital, I was nervous because of the exposure to COVID-19, but I was happy to be observed by the medical professionals. And then the following days after having a reaction, I felt very unsure about everyday life decisions that I once wouldn't have thought twice about. I was not eating very much except for guaranteed nut-free products because I was scared of having another reaction. I knew that I didn't eat a nut product in the food that I had a reaction to, so I thought, is my body like so sensitive now that it reacted to cross-contamination or a trace of a nut? So I've never had this dilemma before, so I was kind of nervous about that. And then I managed my anxiety shortly thereafter by being prepared at all times. I asked more often the important questions and assured myself that if I had a reaction, I would be fine. Having an auto-injector with me boosted my confidence in my recovery because it helped me realize that I am in control and I'm prepared for a reaction. I also benefited from family and friend support after the reaction. Having loved ones as a support system can make the recovery a lot easier, and they can be observers as well to make sure that you don't have a rebound reaction and deal with it alone. Surrounding yourself with loving people that care about you and your well-being makes these challenges a little less daunting, and you could also reach out to members of the food allergy site with supports there. What I learned from this experience is that I need to be assertive and while remaining calm in these situations, because at the end of the day, my life is in my own hands and it is my job to do the right thing and treat the reaction responsibly. When you follow the steps given for any allergy, you are doing all that you can to improve your own recovery. So being nervous during a reaction is completely understandable, but it's important to realize that being confident in your actions will make a big difference in successfully managing a reaction. Whether it's administering the auto-injector yourself or communicating to others that you just don't feel right, or even being very clear with your symptoms. It's better to have an auto-injector and get help than to wonder if you'll be okay otherwise. Thanks for listening.
All right, thanks so much, Viktoria. And I know there's going to be a lot of follow-up questions for you because your story is so recent, especially managing a reaction during COVID-19 times, as well as just experiencing a reaction after 15 years of it's so recent now, and you and your family handled it so well. So thank you for sharing that. We're now going to get into the question portion of our webinar. And just a reminder, if you haven't submitted questions yet, there was an opportunity when you registered for the webinar, but you can still ask questions through the question box on the console, and we'll try to get to as many as possible. But I have a list of all of the questions that came in through the registration process, so we'll try to get through as many as possible. So good to see everybody. Thank you so much for being on this panel today. We have a great list of questions, and I'm really excited just to dig a little deeper, get some more insight on the stories that you shared, and hopefully we'll get some medical advice or some expertise on some of these areas from Dr. Upton too. So the first one, and maybe we'll just start with Dr. Upton, just to reiterate how to know when we should use epinephrine. We had a couple cases here where we had some all-stars handle it very, very well. And especially we had one question during the webinar about when there's no breathing issues present. So when is that right time to administer?
That is one of the most difficult questions in allergy management, because the you know, you're trying to give it. We know that giving epinephrine early is the best thing that you can do in an allergic reaction, but there is this reluctance to give it unless, you know, from the person, so they don't want to give it unless they absolutely need it, but it's very difficult to tell. And so we really say, when in doubt, give it. But certainly if there's breathing symptoms, certainly if there's cardiovascular symptoms, if there's two systems involved, it's better to give it. So meaning, you know, your stomach hurts and you have hives. I also say to give it if there's any severe symptoms. So for example, if you were absolutely covered in hives, so even with just one symptom that's very severe. You know, really, as we so eloquently heard from the panel, it's far less, like the needle really is almost a non-entity in the auto-injectors. It's very small and you barely feel it. And I'm speaking from experience because I too have administered an epinephrine auto-injector. So it really, and it works remarkably well. And I think that once you have that experience of giving it, and so thank you for this panel to really give that firsthand experience, because once you have that experience of giving it and seeing how quickly it works, then I think some of the reluctance is taken away. So really trying your best to become confident that this epinephrine auto-injector is your friend and it's there. It's the best treatment that you can have and you have it in your control. Maybe trying an expired one on an orange so that you really get that experience. You have the motor memory of taking the back off and using it, or if you have the other device of going through the motions for that. You know, it's really, really important that you feel that that's something that you can actually use. And yeah, I mean, you're better to give it than not give it.
Yeah, absolutely. And you know, I'm gonna now ask the question to the panel to follow up on that. You know, we know that there is some reluctance out there, and we know it will work. You've all spoken to that. But what about when you throw the social aspect into the equation? When you're in a group of other people, and you know you're halting an activity, you're pressing the panic button. I need help. How do you manage that type of situation? Perhaps Julia and then Harrison. Do you want to speak to that one?
Okay, I definitely think that one's a tough one. My most recent, the one that I spoke about, my allergic reaction, actually wasn't my first allergic reaction in a social situation. I think I've had about 4 in social situations, one of which being at a Sweet 16 with like 100 friends from my high school there. And I think in that moment, it's important to have someone with you that you absolutely 100% trust, and that's going to be there for you in that moment to assist you with anything that you need. So in that moment, when I realized I was having allergic reaction with all my friends around me, I grabbed my best friend and told her what was happening. And then we excused ourselves from the busy area and did what we had to do. We got help. I injected myself with my auto injector, but I think it's just about making sure that there's someone there that you 100% trust. And if you are in a group of people that aren't very familiar with you or don't know much about your allergies, maybe that's something you need to change. You need to inform them about your allergies and the seriousness of it, just in case anything were to happen.
Sorry, Harrison, do you have anything to add to that? I know you have some experience from your story.
Yeah, completely agree, Julia. From a different angle, I wanted to say that sometimes I forget this, but just remembering that people really do care. You know, here I'm the only one, I think, in my story who thought I was an inconvenience, right? There's a whole bunch of strangers, I don't know my friend's family, but they cared, you know. And like Julia's story, you said that the restaurant people, they cleared out the restaurant just for you, you know. Like there's so many examples of how really people don't want other people to be hurt, you know, and I myself don't want to see someone else in pain. So why is it that I think that I'm an inconvenience to people? It just doesn't make any logical sense, even though the emotional part of my brain says that. So I find that really helps me just to keep reminding myself that people care, people really do.
Good point, Harrison. Remember the good in everyone. There's a question that I'd like to just put out to all of you right now, and maybe we can just kind of do a rapid fire answer on this, because I'm really curious in terms of your allergic reactions that you've had in the past. Has there been a common denominator to it? Was it a labeling issue, cross-contamination? What, for you and your experiences, was there a common thread to your reactions? Maybe you let your guard down. Michael, do you want to start this one?
Sure. For me, I've had 4 reactions. With 3 of them, it's kind of been a bit of a miscommunication between me and whoever is prepping my food. But this recent reaction was just not thoroughly reading the label. But yeah.
Gotcha. Viktoria, what about you? You know, I know that you have this one recent one, but what was what do you think was the main cause of it?
I've had about 3 reactions in my lifetime, 2 of which were when I was really young. So for me, it's very unpredictable. Whenever I have a reaction, my most recent reaction was caused by cross-contamination. So in that case, the only way to be prepared for that is to bring an auto-injector. So I honestly don't think there was a common denominator. I took the necessary steps to try to avoid it, but at the end of the day, if you have a reaction, the best way to be prepared is to have an auto-injector. So I don't think there was any common denominator in my reactions.
Okay. Harrison, Julia, do you have anything to add to that one?
For me, the majority of the time is cross-contamination. I find that's the one that no matter what you do, something can still happen. You can read all the labels, you can take all the steps required before going to a restaurant, but the cross-contamination is just the most unusual circumstance that could potentially happen.
Harrison?
Agree. I've had 4 reactions. The 4th was kayaking. The other 3 were cross-contamination, specifically when someone's prepping my food and I ask them what's in it, and they say things like balsamic vinegar, and I say, okay, sounds good, and that person doesn't know that it has eggs in it, and that kind of thing. Or at a restaurant, when they say that like all of these seasonings are fine, they don't think about cross-contamination on the grill. Things like that people can miss.
Yeah, that expertise that only someone living with this day to day would really understand. Thank you, everyone. The next question, Dr. Upton mentioned about cofactors of other influences on reactions. And I know, Julia, you have more of a rare condition with exercise-induced anaphylaxis. And perhaps you could kind of shed some light on, are there things that you do to help prevent reactions? I know you like exercising, you have allergies. How do you manage this?
Yes. So I exercise pretty much every day. Immediately following that allergic reaction at the gym, I had to kind of re-look at my physical activity and basically when I was scheduling my workouts, which is pretty much how I'm doing it now. So I've learned to, number one, I work out at the beginning of the day before I have anything in my body. I find that's just the best for me in terms of ensuring that I have no food in my in my system. So the likeliness of having an allergic reaction is significantly reduced. However, if by any chance I need to work out later on in the day, I need to take steps in order to ensure that I'm being safe with it. So I'm much more mindful now of what I'm putting into my body during the day at any time, whether I'm working out or whether I'm not working out. It's also allowed me to become a lot more health conscious with the way I eat, because I'm eating a lot more whole foods and ensuring that things that aren't having labels to prevent any type of accident from happening again. So it is a lot of work, it's a lot of homework, but it does get easier. And I would just say being as mindful as you can in what you are ingesting throughout the day can really assist you in those types of situations.
Great attitude. You must be a great athlete with that type of mindset too, of not letting anything stop you. And Dr. Upton, I'm curious, just in terms, I imagine at least a few of our panelists have asthma as well, and you mentioned that as a cofactor. Perhaps you can just speak to some ways to manage asthma in terms of decreasing a severe reaction possibility.
Yes, thank you, Kyle. So I think many people benefit from having an asthma action plan. So really recognizing what symptoms mean that their asthma is not under control. So not everybody, for example, recognizes that having a nighttime cough can be a symptom of their asthma not being totally controlled, whereas many people would recognize if they're actively wheezing that their asthma is not fully controlled. So it's really important that that you learn as much as you can about asthma, and that you know how to control it and when to go up on the medications or to seek medical attention for the asthma. Because the better condition that the lungs are in, it means exactly like so many people have said, there's so many layers to the preparation, because accidents happen. And so if you're in that best position that you can be, if your body is as healthy as possible in terms of the asthma, and if you have the auto-injector with you, then when these accidents happen, and I prefer to call them accidents than mistakes, just because I think we all do our best, and it's impossible to be perfect all the time, and the labeling can be difficult, as Michael mentioned about the P's, and there's some things that people are allergic to that aren't there. So accidents will happen, and so just being in that best position that you can be. And many allergists also give an anaphylaxis action plan, and that anaphylaxis action plan may be encouraging very early use of epinephrine for people that have a history of significant asthma. So really realizing that asthma is a major factor in severe allergic reactions, and everybody doing their best to treat that asthma is so important.
Thank you. And yeah, really just having it part of your overall management plan. We're going to dive a little bit more into the emotional side and how to really manage a reaction confidently. And I'm going to go right to Michael on this one, because he really handled his reactions so incredibly well. And we know it's important to try to stay calm and control the situation. And Michael, what helped you to gain that type of mindset when you dealt with your reaction?
Well, this reaction most recently is the only one I've actually dealt with on my own and given myself the auto injector. But I think the big thing is, as mentioned a bunch, just not hesitating. If you think you need the auto injector, you probably do, and even if you don't, there's no harm in actually using it. So just having that proper plan in place helps me stay calm and really take the initiative and know it's going to be okay if I stick to the plan.
Great mindset. I love it. We're going to go to another category of just in terms of overall support. And this is a really interesting question, and maybe I can direct it to Viktoria, where it goes back to almost that reluctance theme that we discussed earlier, where when you have a reaction, there's almost, I hear this time and time again from youth, there's almost a reluctance to tell anybody, to actually try actively to get support from someone, almost feeling like a burden to tell someone about their allergic reaction. What would you say, Viktoria, to someone in that position, and maybe it's their first reaction in a long time? How do you get that confidence to speak up and get help?
Yeah, I can relate to that feeling for sure. When I was on vacation and I had a reaction, I felt very guilty for having a reaction because I was ruining my family's vacation. But the truth is that I would have been more of a burden to them if I had not been communicating about my reaction, because then something bad will happen to me and then they will feel responsible, and it just goes downhill from there. And also, not communicating about your reaction can make your recovery much more difficult. So it's best to get help no matter where you are or who you're with, and make sure that you're assertive and confident in treating it. So yeah.
Great. And I'd love to just kind of go around the whole panel right now in terms of what you want others to do. What would be ideal for your friends, for caregivers? What could they do to help you out during a reaction? What's the most important one thing that you wish that they knew or they would do to help you out? Julia, do you want to start with that one?
Yeah. When I'm having an allergic reaction, usually my mind's going a mile a minute and thinking of a million different things. I'd appreciate someone just being there for me and holding my hand. Like when I was in the fast food restaurant, that employee that came with a glass of water and held my hand was just so comforting to me, knowing that I'm not calm right now, but you're helping me be calmer because of the way that you're reacting to the situation.
Great point. Michael, go ahead.
Sorry, could you just repeat the question quickly?
Yeah, so in terms of other people, what do you want them to do to help you? I know you've got it under control yourself, but what more could a friend do to help you? What do you want them to know?
Well, my buddy who actually was with me throughout the whole reaction, like it's just nice to have someone there. It's comforting. It makes everything feel better. And I think it's important that just friends in general have a proper understanding of how to use an auto-injector and they know your allergies. That communication piece is really important with everyone around you, whether it's at school. But yeah, that's my advice.
Great point. Harrison, anything to add?
I have a friend who he will tell me to take the auto injector, and if I say no, I don't feel like it, or like I'm trying to rationalize it because I'm not fully there in allergic reaction, he'll say take it or I'm going to give it to you. So I really appreciate friends who are like fiercely there for you and they know the plan and they're going to make sure that you stick with it to just help you when you are not that mentally sound. So I really appreciate that trait from my friends, taking the initiative.
That's great. And I'm going to do one last question, and we'll start with Viktoria on this last one, and we'll go around the horn here. But I'd like to finish off our question period with what's the #1 piece of advice that you would give youth with food allergy who might not have had an allergic reaction in a long time? What's the one thing that you think they should know given your experience with reactions? Viktoria?
Okay, so always be prepared wherever you go and whoever you're with. Never ignore signs of a reaction. Even if you feel like an inconvenience to anyone, treat a reaction responsibly. And sometimes we question if it's a reaction because we feel like we didn't eat the allergen from cross-contamination, but cross-contamination could happen. And never minimize the reaction by what you ate. So finally, be confident, assertive, and calm when treating a reaction. And when you're prepared for a reaction by bringing your auto-injector, use that knowledge to boost your confidence because you are prepared.
Great points. We can make a resource sheet just on all of this advice right now. Julia, what would be your #1 thing?
Be mindful of how you're feeling. I think if you're feeling different, your body's going to know, and somewhere inside, you're going to know that you're feeling a little bit different, and there's a reason you're feeling a little bit different. So it's very important to be mindful of how you're feeling and what potentially could be going on.
Great point. Michael, what would you add as your #1 thing?
As I've said a bunch already, just trust the auto injector. Make sure you're carrying it and trust it.
Good one. Harrison?
I was going to say something like that. You're going to be okay. At the end of the day, the auto injector is designed to save your life. It saved many others. And the process works out. We're all still here today, even multiple reactions. So you'll be fine.
Yeah, great point. And Dr. Upton, we got to close with you. You work with a lot of youth with food allergy. What would be your #1 tip for youth that haven't experienced a reaction?
Yeah, I mean, I often tell youth that, you know, if you had 100 emergidocs and 100 allergists with you, they would give you the epinephrine auto-injector. You know, so you have that best treatment in your hands. And so we do really try to help people remove the fear from the auto-injector, because exactly as you've heard here, it really does work remarkably well. And there's not many conditions that you have the same med in your hand that we would give you, you know, if we were with you. So I do hope that people, I try to shift the fear of it to empowerment of having that treatment there.
Yeah, and I think as this whole webinar can attest, everybody on the panel, it does work. It's worked in multiple situations. It's worked for me. It's worked for everybody here. So thank you for reiterating that. And I do thank our whole panel for joining in today and sharing so much insight and being so brave telling these stories. So thank you all. You can turn off your webcams now, and we'll wrap up the end of the webinar here. But thank you. So that concludes the question portion of our webinar today. And just to do a quick recap, because we've learned so much, one, be prepared for a reaction. It's a real key takeaway, and that's having the emergency plan that accounts for your allergies, asthma, other conditions. Practice with an auto-injector trainer so you're ready if it does happen. And obviously inform your friends, let them know where you carry it, what you're allergic to, what they can do to help. During a reaction, act quickly, as everyone really mentioned today, and confidently. You know what to do. Be assured that you can help yourself, and then get help from others. Don't be shy, just like Julia went into that fast food restaurant and knew she needed help. After a reaction, it's okay to seek support that you need to start rebuilding your confidence again, and learn from this experience and grow. And these are all just really key things to keep in mind. And we'll do one last poll question today, just to wrap up. We've learned a lot, and it really just to find out, after participating in this webinar, how confident are you now in recognizing, treating, and managing an anaphylactic reaction after learning from these wonderful youth? All right, let's see the results of this poll. And unbelievable. We were very high on the somewhat confident before, and now we're an audience that is all of a sudden very confident. So thank you again to our panel for providing so much insight and confidence just in that you can handle reactions. It's not always easy, but it's doable. And I'm glad that so much insight was shared today. And lastly, if you want more information on this topic and others, Food Allergy Canada on our website, we have lots of other webinars on the emotional and social side, more on epinephrine, as well as webinars just for youth on being empowered and handling your allergies accordingly. We have more info on preventing reactions, youth section. Check it all out, foodallergycanada.ca, and also Allergy Pals, Allergy Allies, our mentorship program for youth starts up again this September. You can register very, very shortly. So it's a great program weekly where you can get ongoing support for ages 7 to 15 with other children that have food allergies. I do want to thank our sponsors for this webinar: EpiPen, the Walter and Maria Schroeder Foundation, the Sean Delaney Memorial Golf Classic, and Allergic. You'll also get a short survey through GoToWebinar immediately after, and it's going to pop up on your screen. You'll also receive it in an email. We ask that you please take a few moments to complete it. Your feedback is really crucial in helping us improve our future webinars and to also better understand what additional questions or comments you might have. So be sure to register for our upcoming webinars and events, and check out a recording of this webinar soon. Thank you so much to Dr. Julia Upton, to our wonderful panel, and thank you all for coming to this session. This now concludes our webinar.